Welcome back to the Doctor Next Door. I'm your host, Dr. George Corday. We have a special guest today, Dr. Afolabi-Brown, a triple board certified sleep medicine physician, author of Beyond Tired, and founder of the Restful Sleep Place. She has spent nearly 2 decades helping children and adults overcome sleep problems and is on a mission to help people use sleep as a tool for better health, performance, and quality of life. Welcome, Dr. Afolabi-Brown.
Thank you so much for having me.
Thank you so much for your time. Sleep is such a big deal, as you know. I get
Mm.
so many questions on it on the daily, myself included. I've struggled with insomnia at times, and we thought it'd be great to have someone that is a actual specialist that's dedicated her life to it tell us all the tricks and tips of the trade, so we can get better sleep.
Yeah,
So
I'd love to.
So tell us a little about your journey. Like an ambitious young woman decides, I'm going to dedicate my life to sleep. How do you get to that conclusion?
Yeah, I mean, I think it's, most of the things that fuels our passion are the things that we ourselves struggle with, right? So, I was that poster child of poor sleep right from when I was probably my teens, a lot of anxiety and insomnia, and then going into medical school and, burning the candle on both ends, and then moving forward to residency and motherhood and more training and all of that. And one thing that I noticed that was in constant short supply was sleep. And so when I hit a wall, especially around the time my dad passed away, I really had no buffer, nothing left. And so sleep was something that I started to work on because it felt relatively within my control. And so with doing that and seeing dramatic change, I realized this is, when you see something and you can't unsee it. So I felt like if someone like myself who is a clinician and tells other people to sleep was struggling, how much the layman was struggling as well. And so that really sparked my interest to pursue further training and expertise in sleep medicine.
Absolutely. I mean, sometimes our origin stories are born from our own issues, right? Our own
Mhm.
struggles. So I can relate to that and not getting good sleep and having to figure that out the hard way that we all
Mm.
need. We all need to get good sleep.
Yeah.
So, what about modern life keeps us from getting good sleep? I mean, are there things we're doing differently nowadays? What are your thoughts on that?
Yes, and yes, absolutely. So it's the requirement for sleep and the amount of sleep that we need to thrive has not changed, but the demand that is being placed on us has. And slowly but surely, sleep has been put on the back burner. So we now have this 24-hour lifestyle where everybody's constantly on, thanks to technology. We have this narrative of the hustle and sleep is for suckers. So there's some of that narrative that's impacting us. There's also a lot of people who see sleep as a luxury rather than a necessity. There's shift work, especially with clinicians and even the layman as well, and just demands generally. And then I would say the more connected we've become as a society, the less opportunity we're giving ourselves for sleep. So we're running on a lot of chronic sleep deprivation. But on top of that, there's quite a number of undiagnosed sleep disorders, insomnia being one of them, sleep apnea, all of that. And so all of this is really, I feel like it's reaching ahead.
Yeah. Yeah, you hit on so much in that one answer. I mean, I love how you kinda touched on technology too, because I know that
Mm,
that's big now, with,
yeah.
AI, and I
Mm,
have my iWatch can tell me how much I slept last night, and
yeah.
I see everybody with the Oura rings and all that stuff. You know, does that stuff actually help? Does tracking and monitoring your sleep, neurotically actually help, or is it more of a detriment to our overall sleep? What do you think?
So tracking your sleep, and I actually am wearing an Aura ring for those, I mean, watching this on audio or listening to this on audio. Tracking your sleep provides insights. Tracking it neurotically is dangerous in terms of detrimental for your sleep. So, sometimes you have, I look at it the same way I look at people who maybe are looking at how many calories are in the bowl of ice cream they're having, or, how much protein is in that bar, or that bowl of whatever it is you're having. And so it's supposed to help you make some informed choices. You can say, well, looks like I had a glass of wine last night. Deep sleep seems to be low, or I've been having a couple of nightcaps over the last 1 week, and look at the trends, right? So it's supposed to give you information that can probably or hopefully help you make some behavioral changes. But when we have people, the actual people that I tend to see this have a negative impact on are people who have insomnia. Because with insomnia, there's always that tendency towards sleep performance anxiety. You want to do more. You want to try to control so many factors. You want to try hard to sleep. You're stopping the caffeine. And so now you're looking at data telling you, even after everything you did, you failed at sleep every morning. So it now causes more anxiety, which fuels that sleep related anxiety, which makes the insomnia worse. But for that person who is just looking to optimize their sleep the same way they're trying to optimize their whole health, their overall health, looking at data is not necessarily harmful. I think it's the obsession that I would say is not beneficial. And then the other thing I would say is look at trends, because there's so much day-to-day variability. I've had, even myself personally, experiences where I felt like I wake up feeling like just a whole load of sunshine, and I see, and it says, oh yeah, you only had 10% deep sleep. You're like, wait, what? And sometimes that can play a role in, oh, okay, I kind of feel tired actually. The morning wasn't that great. So there's that narrative you get from looking at day-to-day data. But if you look at trends to say, what's been going on over the last 2 weeks? Is there anything I can do to change my behavior, to improve my sleep? I don't think that's harmful.
I think if you are neurotic to start and you're worried about sleep performance, as you would say,
Yeah.
I could see how it could turn into a problem. But excellent. I'm actually going to take the last piece there. You mentioned sunshine. I've read a lot of interesting data on getting sunlight early in the morning throughout the day and how that may help with sleep. Um, any thoughts on that, or what? I know it's not widely accepted, and everybody doesn't talk about that. But I know that there are some studies.
Yeah, absolutely. That's one of the most natural ways when we talk about, healing your sleep naturally and things like that, which is, everybody's into this whole holistic and natural move of everything you're talking about. Light exposure, appropriate light exposure can be a game changer. Because one thing we know is we all have this, our circadian rhythm, which is that 24-hour clock that regulates when we go to sleep, when we wake up, regulates the release of melatonin in the evening and things like that. There are certain cues that optimize our circadian or regulate our circadian rhythm. One of the biggest cues you have is light. So what happens with light is that we have if once you have some exposure to light, what happens is that light sends signals to a very small structure in your brain called the pineal gland. And so what that does is it releases the hormone or it decreases the release of melatonin. In the evening, when there's no light, it increases the secretion of melatonin. That's why we call melatonin the darkness hormone. So when you wake up in the morning and expose yourself to light, especially within the first 30 minutes, what you're doing is you're re-anchoring that circadian rhythm to say morning has started. Of course, the flow of the melatonin is going to stop because of that exposure. On the inverse, when you expose yourself to blue light, to light in the evening, especially blue wavelength light, what that does is it sends signals to your brain to say, oh, is it morning or daytime? And so this is where we start to talk about blue light exposure and technology and things like that. So appropriately timed light, natural light, sunshine has the widest spectrum, which is why that's what we recommend. But any type of blue light will provide that kind of signal. And so appropriately timed light is huge when it comes to regulating our circadian rhythm.
Very nice. Thank you for that. Is there any guidance, or is it kind of, I read some stuff about 30 minutes, an hour, any guidance as to how much? And then are all of our technologies releasing that blue light? Cell phone, iPad, TV? Is it kind of broad brush?
Yeah.
Okay.
Yeah, I would say within the first, usually I say within the first 20 to 30 minutes, exposing yourself to any form of natural, even on a cloudy day, the intensity of the light you get from just natural light is great to help with regulating and syncing your circadian rhythm. So that's the best option. If you're in a place where it doesn't get light until darker, until later on in the day, and you have to maybe wake up super early in the morning, then you can get things like a light box. Usually we'll say 10,000 lux worth of either a light box or a light visor. You could get this on Amazon and other stores. Once you just say morning light or some treatment or something, you'll get that. Now,
Okay.
for the technology, yes, all of them have about the same level of blue light exposure. With this, the closer the source of that blue light
Uh,
is, the higher the intensity. So when you have your phone, this is why having your phone in bed is not the best thing to do when it comes to optimizing your sleep. But I have people who maybe they're sitting on a couch downstairs and they have the TV, a few feet away. It's still going to release that blue light, but it's not as intense. So
mhm.
I would say the it's really about the proximity of it, and then
Yeah.
of course about the brightness. So one of the ways that you can address this would be either moving your phone to the night shift mode, so it really makes that light much dimmer, and you're getting less of an exposure. And I would say at least maybe 30 to 60 minutes before bed, you really want to start to minimize your exposure to blue light again, because you want to be able to facilitate sleep onset.
Okay.
But even beyond that, beyond the blue light itself, when it comes to being able to fall asleep on time, and mitigating the impact of technology, I would say what you want to do is not just focus on the blue light or no blue light, but the content of what you're consuming before bed. So if I'm scrolling on TikTok in dim light conditions, I will still have a very late sleep onset for most of the time. So it's not
Yeah.
just about the light, it's the
Yeah.
content of what you're
Yeah.
watching and how activating it is for you, especially at bedtime.
So no Fox News or CNN at right
No,
before bed.
that's gonna
Okay.
make you very frustrated and angry, and you're not gonna be able to wind down. Most
Yeah.
especially with the
Yeah.
kind of news we're hearing nowadays. Yeah.
That's right. That's right. Okay. I would be remiss if I didn't mention you mentioned wine. I have a lot of
Yeah.
younger audience members. Tell me about alcohol, nicotine, different things like that, and how it impacts sleep.
Yeah. So alcohol is honestly in a category of its own. It's a sedative. And so most people will say, yes, I use a glass of wine to relax and things like that. And it is a sedative. It will help you fall asleep. The issue is that it is metabolized very rapidly. And so usually the second half of the night, you start to see the effects of the withdrawal pretty much. So it's the liver metabolizes it very quickly. What you will see initially is it will suppress a stage of sleep called REM sleep or dream sleep. And so now in the second half of the night, you might get what we call a REM rebound, where you're now having all kinds of weird, wacky dreams. You're having a lot of fragmented sleep. And so people wake up in the morning with the so-called hangover. And this is that
Mhm,
grogginess, exhaustion, or what we call sleep inertia that happens.
mhm,
The other thing with alcohol is that it relaxes the muscles of the upper airway. Again, it's that general relaxation
mhm.
effect. And so if you are somebody who either snores or you even have the slightest risk to have sleep apnea, alcohol literally and figuratively will push you over the edge, because now you're really exposing your airway to more collapse, and it can actually worsen sleep apnea. So for those reasons and several other reasons, we recommend limiting the amount of alcohol you're taking before bed, and definitely not making it something that you do habitually.
Yeah, I will agree with your assessment that it helps me get to sleep, but I
Mm,
don't sleep well. So
yeah.
yeah, absolutely. Any thoughts on caffeine and medications and things like that? Just in general, just what are your thoughts on that? I'm a coffee drinker, so I'm biased,
Mm-hmm.
but wanted to get your thoughts.
Yeah. So with caffeine, it is the most commonly used stimulant. It can enhance alertness. It can actually enhance performance to some degree. And I would say the timing is key. Everybody has different rates of metabolism of caffeine. Some metabolize earlier, some metabolize slower, but we usually would say the half life is anywhere from 6 to 8 hours. So if you're going to drink caffeine, that is absolutely fine, but you do want to make sure that you limit caffeine intake several hours before bed. So, for instance, I would usually say about at least 8 hours before bed, you want to probably be done with caffeine intake, because what it does is it masks sleepiness. There's a chemical in the brain called adenosine, which is supposed to be the chemical that helps you to know, okay, I'm sleepy. It masks that. And when it does that, what will happen is when you get to sleep, you may not necessarily get into that very deep restorative sleep as a result. So again, most people respond differently. Some people say they drink caffeine all the way with dinner and they fall asleep fine. But for most of the time, that's something that you want to try to address.
I think that's real interesting too, because we don't think about trope as like everybody's different. My
Mm-hmm.
sensitivity may be different than somebody else. So yeah, you
Yeah.
may be able to drink it a little closer to bed, but I may not be able to. That's something I
Yeah.
discovered about myself. I
Mm.
cannot have caffeine, within several hours of going to
Before.
sleep.
Yeah.
Sure. So let's talk about medications a little bit, if you don't mind.
Sure.
There's a lot of stuff out there. There's Ambien, right? So there's a prescribed stuff. There's stuff over the counter. A lot of my patients do Benadryl,
Mm.
Unisom, you name it, right? I mean, obviously, we can't get to all the nitty gritty here today, but just your thoughts in general. I mean, is it a good thing to use a sleep adjunct? Should you kind of stay away from them? Is it good temporarily? Are they addictive? What are your thoughts?
So the thing about it is it's important to figure out why do you need a sleep aid. If you had some something happen, right? Maybe a loss of a loved one, something traumatic or something. You couldn't sleep maybe for a couple of days. Yes, you could use a sleep aid here and there. But especially when it's habitual, we got to step back and say, why do we need this? Because it might be because you actually have insomnia. It might be because you have another sleep disorder, and those medications or sleep aids might mask it. And then the other thing we know is a lot of the over-the-counter sleep aids contain things like diphenhydramine. Some of them contain high doses of things like Tylenol. Now, using that every night is really not ideal because, Tylenol is metabolized by the liver. You don't have pain. Why are you using it? Yeah, because it has, either doxylamine or diphenhydramine with it. So that's something you want to be wary of. The other piece is most of the over-the-counter aids, again, contain things like diphenhydramine, which on the long term, and even for anybody, you know how you feel when you've taken a whole lot of Benadryl. And the next morning, you're just not quite yourself. You're sedated, you're groggy. There's increased risk of falls and things like that. And there's also all the side effects, the dry mouth and all of that. So not at all ideal for long-term use. You have a cold, you need to take a little bit here and there, that's fine. But never for long-term use because you're not addressing the underlying issue. So really, we want to focus on what's driving this. And the same actually goes for medications. Most people use sleep medications to treat something like insomnia. Now, insomnia is especially chronic insomnia is when you have difficulties falling asleep or staying asleep. The number one, the gold standard treatment for insomnia is actually not medications, but people don't realize that the gold standard for treating insomnia is cognitive behavioral therapy for insomnia. So this is a program where you actually are addressing the thoughts, the behaviors, the habits around your sleep, and again, addressing that sleep anxiety and frustration that you're having. So using medications maybe as a bridge, but it's absolutely never a long-term solution.
Wonderful. I was thinking when you were talking, who do you go see someone like Dr. Afolabi Brown when you need that cognitive behavioral therapy? Who do you go see?
Yes, yes. So, for instance, I'm a sleep medicine physician. So what I do is diagnose people with sleep disorders and provide treatment for those sleep disorders. So either people who cannot sleep, who will not sleep, who are dissatisfied with their sleep, we're able to figure out what's going on, because there's so many sleep disorders that people are not aware of, and they just think, oh, it's normal. So if you're snoring maybe 3 to 5 nights a week, you're waking up fatigued, you're waking up with a dry mouth, you're depending on these so-called over-the-counter sleep aids, or sleep medication, you've been prescribed sleep medications for a long time. All those patients have an underlying sleep disorder that we're able to help address. So that's really it. So we offer the diagnostics for things like, if you have somebody who has sleep apnea, or somebody who has even a rare condition like narcolepsy, or somebody who has insomnia, we're able to provide the right treatment options for them. So somebody like myself is the kind of person you want to see. If you have had a full sleep evaluation and they say, oh, you know what, you don't have any other thing, any other medical sleep disorder, you may see, sometimes we'll recommend seeing a behavioral sleep specialist. They really just focus on that CBTI piece. But for myself, we kind of do things a little bit more holistically.
Very good. Nice. So there's different, even within sleep, there's different, there's
Yeah.
different components and specialists. Okay.
Ye-
What are some uncommon things that you see related to chronic sleep deprivation? So obviously, you don't have any energy, right? I don't feel like myself, lethargy, things like that. But what are some uncommon things that may be manifesting themselves in someone that doesn't get enough sleep chronically?
Yeah. So yes, you're right. The loss of energy, poor decision making. I've seen people, leaders, really, really become less than optimal leaders. I've seen teams fall apart because there's many of the team members are not sleeping well. I've seen lack of empathy. That's actually data that we see, like your empathy towards yourself and your empathy towards others can be or decrease in that can be as a result of chronic sleep deprivation. I've also seen things like somatic symptoms like anxiety, palpitations, waking up a little bit short of breath, um, increased risk of injuries. So especially for a lot of the athletes that I work with, they're less likely to recover from their games or sports and things like that, and they're more likely to get into to have sports related injuries as well. So those are a few. Poor academic performance. There's a whole lot. And now we're seeing now that a lot of people that are actually diagnosed with conditions like ADHD, many of them have undiagnosed and untreated sleep disorders.
Wow. Look at that. ADHD.
Mm,
I've never made that association before. That's
yeah.
interesting. So, I mean, you talked about injuries, decision making, all that. Are there other things like what if I don't have any of those issues and I'm not sleeping? Are there other things that maybe impacting me? Are there other risks for a tender aged 41-year-old?
Yeah, and this is very common. This is where we see, because I see both children and adults, and especially our beautiful, amazing teenagers and young adults just feel like they are, you know, they
Invincible.
just can't, yeah, invincible, really. And they feel like, well, I'm doing all of this. You will eventually hit a wall. And so I think that's really what we're trying to prevent. So, we do see over time cognitive decline associated with untreated sleep disorders or chronic sleep deprivation. So there's now research showing that there's increased risk of things like dementia, Alzheimer's when you don't sleep well. I mean, executive decision making. So maybe you are a B plus student. Uh, it may not feel like much to you on a little bit of sleep, but imagine the difference between good sleep and poor sleep, being that you can actually have been an A plus student. And there's been research that has done this, where they had high school students subject to less than 6 hours of sleep, and then children subjected to about 8 to 10 hours of sleep. And there was a difference between getting an A, the glaring difference, some of them, between getting an A and actually getting an F. So
Wow.
that's why. So when you think about, you're okay, but are you at your optimum? And this is the kind of conversation I have with a lot of my patients. Yes, you're doing okay. You don't have a heart attack, you don't have high blood pressure, all of which are related to insufficient sleep. But How about those cognitive pieces? How about the mood issues? How about your relationships, the irritability, the anxiety? All of those things are actually related. And then there are, of course, metabolic issues that can be related to poor sleep. Over time, we start to see a higher risk of what we call impaired glucose tolerance. These are people who can develop pre-diabetes. Uh, Making decisions, high quality decisions, can also impact our nutrition. So we do see a higher risk of obesity with poor sleep over time. And then, like I mentioned, things like hypertension, and even if you're not experiencing those things now, we're not going to wait for you to develop that. So I think this is just something to tell people to be cautious, or to let people know you can be cautious about, and you can take some proactive measures to decrease the occurrence of all those things,
Yeah, I mean,
conditions.
wonderfully said. I think that a lot of times we put sleep in this box. It's only for
Yeah.
energy, but it affects all those other things. You talked about high blood pressure, you talk about weight, you talk about glucose. I mean, there's so many different things. So thank you for that. What are the biggest misconceptions? 7 to 9 hours. It needs to be at this time. If you don't wake up,
Mm.
what are some of the big myths associated with sleep?
Yeah, the 8 hours, I need 8 hours of sleep to survive is a myth. But also I'm okay with less than 6 hours of sleep to thrive is a myth as well. So everybody's sleep need varies. Some people need 7 hours, some people need 6 hours and 59 minutes, some people need 9 hours. So the 8 hour myth is really what it is, a myth. And then also the less than 6 hours is a myth because many people are just chronically sleep deprived, and they've been so used to living in this state of chronic sleep deprivation they don't even realize that they are. And the recommendations are anywhere from about 7 to 9 hours for adults and things like that. And so over time, this clear research has shown people who are getting consistently less than 6 hours are at risk for all these adverse consequences: cognitive decline, cardiovascular factors, insulin, dysregulation and things like that. So those are two very common myths, I would say. And then there are other ones like we talked about already. Alcohol helps me sleep. No, it doesn't. It fragments your sleep, but it might help you pass out. Some people say things like, if I sleep, snoring means I'm sleeping hard or I'm getting deep sleep. That's a lie. Nobody should make any noise when they're sleeping. So it's
That's a
abnormal.
good one. Yeah, yeah.
So you need to have that checked out because you might be dealing with sleep apnea. So those are some of the some common myths.
Well, thank you so much, Dr. Afolabi Brown. Before we let you go, I would get in trouble if I didn't ask how you personally go to sleep every night. You're triple boarded. You understand this, so we need to know how you get to sleep every night so we can implement those same things.
Yes, yes. And I would say I'm human, so I'm not perfect. I'm not the perfect sleeper. I've had my own fair challenge. But one of the things that I make sure that I do not miss is having that bedtime routine. And it sounds very cliche, very generic. Most people are looking for some big fancy thing. No, it's very simple. I take a bath every night, a warm bath, because it cools down my body, drops my core body temperature. When your core body temperature is low enough, that actually facilitates the release of melatonin. I dim the lights in my bedroom. Again, we're minimizing the exposure to bright light. I usually will do some journaling because I'm very busy. And so I'm able to sort of do a mind dump, talk about the things I'm grateful for. I'll read my Bible, say my prayers. So those are things that cues my body because it's become a ritual that I do every single night. Even if I'm traveling, I'll do a modified version of it. And then from there, I usually will listen. I may listen to either a meditation or for something for 5 minutes, and then I drift off to sleep. Now, there are seasons when I have a hard time sleeping. Maybe something stressful is happening. If I wake up in the middle of the night and I find that I'm tossing and turning and I'm really having a hard time to fall back asleep, I usually will get out of bed, just do something relaxing and get back into bed. And then the other thing I do, like clockwork, is I wake up the same time every day, whether it's the weekend, whether it's the weekday. I mean, on the weekends, I may maybe stretch it by like 30 minutes or so. So that keeps my circadian rhythm really well regulated.
Thank you so much, Dr. Afolabi Brown. Great, great interview. We'd love to have you back. We really appreciate your time. And go visit her page and support her.
No problem. So you can find me on Instagram at Restful Sleep MD. And then my website really will take you to my practice as well as tons and tons of resources. I have a YouTube channel, all of that. That's therestfulsleepplace.com. And we see patients in Pennsylvania, California, New Jersey. We see patients by telemedicine as well as in person. And I have links to courses, blogs, again, so much information. But those two places, Instagram as well as my website, would be the top places to find me.
Excellent. Thank you guys for tuning in to the Doctor Next Door. Everybody have a great evening.